For over 20 years, I've specialized in one of the most overlooked problems in senior medicine: muscle loss, sarcopenia. And in my clinic, I've used simple tests like this one to catch it early, before it steals a patient's independence. I've watched the same quiet tragedy unfold in my exam room over and over again. A patient walks in, 65, 70 years old. They tell me they feel fine. A little slower, maybe? A little weaker? Just getting older, doc, they say. Then I run a simple 30-second test on them. Right there in the office. No machines, no blood work. And in those 30 seconds, I can predict, with frightening accuracy, whether they'll still be walking on their own 5 years from now. I'm Dr. Cecilia Grant. Today, I'm going to teach you that same test. You can do it at home in the next few minutes, sitting in your own chair. But before I show you, you need to know what it's actually measuring. Because once you do, you'll never look at aging the same way again. Let's get started. If you're over 60 or you love someone who is, I want you to listen carefully. Because what I'm about to share with you affects nearly every senior in America. And most doctors don't even bring it up. After age 30, the human body starts quietly losing muscle. A tiny bit each year. So small you don't notice it. But here's what I've seen happen in my own patients after 60. That muscle loss accelerates dramatically. By age 70, the average senior has lost up to 30% of their muscle mass. By 80, that number can climb to 50%. 50%, half the muscle you had in your prime, gone. And in my practice, I've seen what that really means. It's not just thinner arms or weaker legs. It's a harder time getting out of a chair. Trouble climbing stairs. More trips, more falls. Broken hips. Slower recovery from every illness, every surgery. And eventually, the moment no senior wants to face, losing the ability to live in their own home. This isn't normal aging. I want to be very clear about that. It's a disease. It has a medical name. And in my opinion, after 20 years specializing in this exact condition, it is one of the most underdiagnosed problems in medicine today. It's called sarcopenia. Before I go any further, I want to pause for a moment and ask you something. Because in 20 years of treating muscle loss, I've found that the seniors who get the best results are the ones who first admitted, honestly, why they were paying attention in the first place. So tell me in the comments below, are you here because you've noticed your own strength changing? Slower stairs, weaker grip, more tired than you used to be? Or are you watching for someone you love? A husband, a mother, a parent who seems to be slipping a little? There's no wrong answer. But I read every comment on these videos. And honestly, your answer helps me know exactly what to cover next, so that I can help more seniors and more families like yours. Now, let me explain what's actually happening inside your body. Because once you see it, everything I'm about to teach you will make sense. In just a few minutes, I'm going to walk you through the same 3 at-home tests I use with my patients in my sarcopenia clinic. They reveal whether muscle loss has already started in your body. And I'll tell you right now, most people who try these are shocked at what they find. After that, I'm going to share the 3 steps I give to my own patients to reverse it. Yes, I said reverse. I've seen it happen at 70. I've seen it happen at 80. I've even seen it happen in patients in their 90s. But first, you have to understand why this is happening inside your body. Because once you see what's really going on in your muscles, the solution becomes obvious. Stick with me. Let me explain what's actually happening inside your body after 60. I'll keep this simple. The way I'd explain it to a patient in my office. Every single day, your muscles fight a quiet battle. On one side, your body is building new muscle protein. On the other side, it's breaking old muscle down. That's normal. That's how it works at every age. When you're young, building wins. Easily. Your muscles grow, repair quickly, and stay strong. But after 60, something shifts. We call it anabolic resistance. Fancy term, simple meaning. Your muscles stop responding the way they used to. You can eat the same foods you've always eaten. Do the same activities. Even feel like you're staying active. But your body is no longer building muscle fast enough to replace what it's losing. The result is a slow, invisible decline. You don't notice it at first. Then one day, you reach for something on a high shelf, and you can't quite get it. You try to open a jar, and your hand won't grip. You stand up from the couch, and you wobble. I've had patients describe that exact moment to me. The first time they realized something had changed, and I've had to tell them gently, that's not just getting old. That's sarcopenia. And here's what concerns me most. What I wish every senior knew. The research published in major medical journals is crystal clear. Sarcopenia doubles your risk of falls, triples your risk of hospitalization, and seniors with severe muscle loss are more than twice as likely to die within 5 years from any cause. I'm not saying that to scare you. I'm saying it because in 20 years of treating this condition, I have seen the consequences of ignoring it, and I don't want that to happen to you. Now, before I show you the tests, there's something I need you to hear. Because in 20 years of specializing in muscle loss, this is the part I wish every senior understood. Sarcopenia is one of the most reversible conditions in all of aging. Not slowable, not just manageable, reversible. I've seen it with my own eyes. Patients in their 80s, even in their 90s, building back muscle they thought was gone forever. People who came into my office leaning on a walker, and 6 months later, walking on their own. Patients who couldn't stand up from a chair without help, eventually doing 10 in a row. The science says it. My patients prove it. Your body is ready. It just needs the right signals. So here's how we're going to do this. First, I'll walk you through the 3 tests so you know exactly where you stand right now. Then, I'll give you the 3 steps I use with my own patients to take their strength back. Ready? Let's start with the test. Test number 1, the chair stand test. Sit in a sturdy chair, feet flat on the floor. Cross your arms over your chest. Now, without using your hands, stand up and sit back down 5 times in a row as fast as you safely can. Time yourself. Here's how I score it in my office. Under 12 seconds. Your leg strength is good. Stay where you are. 12 to 15 seconds. You're in the warning zone. Muscle loss has likely started. Over 15 seconds, or if you needed your hands, you're showing strong signs of sarcopenia. I want you to pay very close attention to the rest of this video. Test number 2, the single leg stand. Stand near a wall or a sturdy counter, for safety please. Lift one foot off the ground. Balance on the other leg. Time how long you can hold it without grabbing for support. 30 seconds or more. Excellent. 10 to 30 seconds. Decline has started. Less than 10 seconds. That's a major red flag. And I want you to understand, this isn't just a balance test. Balance depends on muscle. Weak legs can't stabilize you. That's why so many of the falls I see in my practice seem to happen out of nowhere. They don't. The muscle was already gone. Test number 3, the grip test. This is the most powerful predictor of all, and the one I trust most in my practice. Decades of research have shown that grip strength is one of the strongest predictors of longevity in seniors. Stronger than blood pressure. Stronger than cholesterol. Here's a simple at-home version. Firmly squeeze a tennis ball or a stress ball in each hand. If you struggle to squeeze it hard, if one hand is noticeably weaker than the other, or if you can't hold the squeeze for 10 full seconds, your overall muscle strength is declining. If you failed one of those tests, or 2, or all 3, I don't want you to panic. I want you to stay with me. Because the next part of this video is the part that matters most. I'm about to give you the same 3 steps I give my own patients in my sarcopenia clinic. The ones I've watched rebuild their strength at 70, 80, and beyond. You don't need a gym. You don't need expensive equipment. You don't need to become an athlete. You just need to start. If you're going to remember anything from this entire video, remember the next 90 seconds. Because what I'm about to share is, in my professional opinion, the most powerful intervention available for sarcopenia. And it's something you can begin today. Step 1. Eat far more protein than you're eating now. In my practice, I found that the #1 cause of sarcopenia after 60 is simple: not enough protein. Most of my senior patients eat about half of what they actually need. Here's the rule I give them, and the one current research supports. Aim for at least 1 gram of protein per pound of your ideal body weight, spread evenly across your meals. If your ideal weight is 150 pounds, that's 150 grams of protein a day, about 30 to 40 grams per meal. The best sources I recommend: eggs, fish, chicken, Greek yogurt, cottage cheese, beans, and a quality protein powder if needed. And here's the most important thing I tell every patient. Do not skip protein at breakfast. That's where the muscle loss starts for most seniors. Step 2. Resistance training. Not walking. Resistance. I'll say something that might surprise you, but I tell my patients this all the time. Walking is wonderful for your heart, but walking does almost nothing for muscle loss. To stop sarcopenia, your muscles have to push or pull against something. That can be light dumbbells, resistance bands, or even your own body weight. Here's what I recommend to start. 2 short sessions a week, just 10 minutes each. Basic moves: sit to stands, wall push-ups, seated leg raises, and standing arm curls with a light weight. That's the dose. And the research backs me up. Even seniors in their 90s build muscle when they start a program like this. I've watched it happen in my own practice many times. By the way, if you've been thinking about your own answer to the question I asked earlier, I'd really love to hear from you in the comments. It always means more than you realize. Step 3. Vitamin D and sleep. These are the two things almost everyone forgets, including most doctors. Low vitamin D directly accelerates muscle loss. I check my patients' levels routinely, and the vast majority are deficient. Talk to your own doctor about getting tested. That's something only they can do for your individual case. And sleep, real, deep sleep, is when your body actually repairs muscle. If you're getting less than 6 hours a night, you can do everything else right and still lose ground. That's the foundation. Protein, resistance, vitamin D, and sleep. Start there. And based on what I've seen in my clinic, your body will start responding within weeks. Before you go, I want to leave you with one last thing. Because in 20 years of specializing in muscle loss, this is the truth I wish I could tell every senior in America. Sarcopenia is not inevitable. You are not too old. Your body still wants to build muscle. You just have to give it the right signals. And now you know what those are. Every senior I've watched lose their independence, to a walker, to a fall, to a broken hip, got their one missed protein meal, one skipped strength session, one slow decline at a time. You can choose a different path, starting with your very next meal. If this video helped you understand your own body a little better, please give it a like. It's a small thing, but it helps me reach more seniors who need this information, many of whom don't even know sarcopenia has a name yet. And if you'd like to stay strong, stay mobile, and stay independent for as long as possible, please subscribe to the channel. I post new videos every week, sharing what I've learned in 3 decades of medicine and 20 years specializing in muscle health, so seniors like you don't have to figure this out alone. One last thing, if you know someone over 60 whose strength matters to you, a parent, a spouse, a friend, please share this video with them. Sometimes the right information at the right time changes everything. Until then, take care of yourself and stay strong. I'm Dr. Cecilia Grant.